This educational content is reviewed by a professional doctor and researchers to ensure factual accuracy and is not a substitute for medical advice. You're under 40, you feel healthy, and you think you have time. But in 2025, heart attacks in young adults are skyrocketing. In the US, someone has a heart attack every 40 seconds. By the time this video ends, 6 people will be fighting for their lives. Imagine a silent killer lurking within your body, ready to strike without warning. Most people think a heart attack is a sudden, Hollywood-style collapse. But in reality, your body might be giving you silent warnings days, even weeks before the big one. Today, we're going inside the human body to see exactly what happens when your plumbing fails, and why the first 60 seconds are the difference between life and permanent damage. A heart attack, or myocardial infarction, occurs when blood flow to a part of the heart is severely reduced or completely blocked. It happens when a coronary artery is plaqued. These arteries are supposed to supply blood to heart muscles itself, and if it stops, oxygen supply is disrupted. Without oxygen, heart muscle cells begin to die within minutes. First, we have to clear up a massive misconception. A heart attack is not the same as cardiac arrest. Think of your heart like a house. Cardiac arrest is an electrical problem. The power goes out and the heart stops beating entirely. But a heart attack? That's a plumbing problem. It's called a myocardial infarction, or MI. It happens when the pipes that feed your heart muscle with oxygen get clogged. This critical blockage is most often caused by a buildup of fat, cholesterol, and other substances. It's like rust inside a pipe. But the heart attack doesn't happen because the pipe is narrow. It happens when that plaque ruptures. When it breaks, your body treats it like an injury and sends platelets to form a clot. That clot is the real killer. The most common symptom is chest pain, often described as pressure, tightness, or a squeezing sensation, which can spread to your arm, neck, jaw, or back. Other symptoms include shortness of breath, cold sweats, nausea, and lightheadedness. Women may experience more subtle symptoms like fatigue or back pain. Many people wait hours to call 911, and by then, the damage is done. Immediately call 911 and reach an ICU within 30 minutes of first symptom to avoid permanent damage. Never drive a vehicle when going to a hospital. If you arrive at a hospital that doesn't have a specialized surgical suite, doctors reach for thrombolytics, commonly known as Clot-Busters. Think of these as high-strength liquid Drano for your bloodstream. These drugs are injected intravenously and travel to the site of the blockage. Their job is to find the fibrin, the protein mesh that holds a blood clot together, and dissolve it. While effective, they are a race against the clock. They work best if administered within 30 minutes of arrival. Cardiac stenting is a gold standard procedure used to open a blocked heart artery. A thin tube is passed through a blood vessel from your wrist all the way to your heart to reach the blockage. A small balloon is inflated to widen the artery. A metal stent is then placed to keep it open. It's a miracle of engineering that happens while you're still awake. Blood flow to the heart improves immediately, and it reduces chest pain and future heart attack risk. Risk factors for heart attack include high blood pressure, high cholesterol, diabetes, smoking, obesity, and a family history of heart disease. Most heart attacks can be prevented with daily habits. Managing stress protects your heart from constant strain. Getting enough sleep helps regulate blood pressure and hormones. Smoking damages blood vessels and speeds up artery blockage. A healthy diet reduces cholesterol and inflammation. Small lifestyle changes can greatly lower heart attack risk. Take good care of your heart, and if you learned something that could save a life today, hit subscribe button for more informative content.